So hello everyone, today we are going to discuss the types of drugs. Okay, so in this category there are several types of drug like prototype drugs, prototype drugs. Okay, like you can say prodrugs. Okay, like orphan drugs. Okay, and placebo. Okay, so one by one we will discuss here. So first of all, if you see the prototype drugs. Okay, so if you talk about the prototype drugs, so you can explain this that a single drug that represent a drug class. Okay, so a single drug, like if you are talking about the beta blockers, which is a class of drugs, beta blockers. Okay, best example is here propanol propanolol propanolol. Okay, so it is the drug which it beta blockers is a class of drugs. Okay, and one member is propanolol. Okay, so it having the chemical properties responsible to block the beta channels. Okay, so here it is the one example. And if you talk about the non-steroidal anti-inflammatory drugs. Okay, non-steroidal anti-inflammatory drugs, it is a class. Okay, and in this class several drugs are included in this. Okay, so if you talk about one single member, so here we will taking one drug named is aspirin. Okay, very common medicine, very common drug, not medicine. Okay, which is comes under the non-steroidal anti-inflammatory drugs. Okay, means the chemical properties which is responsible for to act as a non-steroidal anti-inflammatory drugs. Okay, the third one is that suppose if you are talking about the calcium channel blockers. Okay, so calcium channel blockers is a class of drugs, and the best drug is in this class is nifedipine. Okay, so nifedipine is the one drug which represents all the properties of calcium channel blocker. Okay, like that if you talk about the opioids. Okay, so opioids the drug. Okay, so it is a class of drugs, means there are several drugs which comes under this category, but best example is morphine. Okay, the properties, it shows the analgesic properties. Okay, and it is the best drug which represented a drug of the opioid classes. Okay, so it is the prototype drugs. Okay, and if you talk about the prodrugs. Okay, so it will, I think you will understand what is the prototype drugs. Okay, so if you talk about the prodrugs. Okay, so prodrugs, if you talk about the prodrugs, if you see, suppose the L-dopa is the drug. Okay, it remain inactive outside. Okay, and when the drug is administered in the patient body, okay, through various routes. Okay, through various routes. Okay, like orally or intravenously, like that. Okay, so what happened here, these drugs metabolize, means metabolize, okay, within your body and converted to converted to active ones. Okay, so after conversion of active drugs, they shows the pharmacological responses. Pharmacological response. Okay, so means what I want to say that it is the inactive drugs. Products are the, inactive outside, but when they are administered in patient body, they become active. Means in biological environment, they change to the active ones. Means from inactive to active ones. Okay, so you can also define this drug that the drug that after administration is metabolized into a pharmacologically active drugs. Okay, so if you talk about the best example is L-dopa. L-dopa is inactive. It is inactive. Okay, and its active drug is when it is metabolized and converted to dopamine. So dopamine is the active drug. Okay, means dopamine means it is the pharmacologically active drugs, but it is inactive. Okay, so like that, if you talk about another example, I will talk about the enalapril. Okay, enalapril. Okay, it is the inactive. Okay, it is inactive, but when it is metabolized inside your body, it convert to enalaprillate. Okay, so it is the active. Means this compound, okay, is responsible for pharmacological active drugs. Okay, so another drug, if you talk about the omeprazole. Okay, omeprazole, it is inactive and it is converted to omeprazole sulfonamide. Sulfonamide. Okay, so I think you will understand what is the meaning of products. Okay, so it is the inactive drugs, but inside your body, when these drugs are metabolized, they converted to pharmacologically active drugs. Okay, the one term pharmacologically. Okay, you should be understand what is the meaning of that. Pharmacologically. Okay, it is the actually pharmacological. Okay, pharmacological means it having, you can say, biologically, you can say also biologically, means any drug. When pharma is included, means drug. We will talk about the drug action. Okay, inside your body. Okay, so it is the pharmacological, means drug action inside your body. Okay, because inside your body there are several receptors, and each receptor is specific for any drugs. Means is a specific drug, you can say. Okay, so it is the products. Okay, so if you talk about the placebo, what happened here, these are the inactive drugs. Okay, means no active ingredient is present. No active ingredient is present. Okay, but what happened, their size, shape and other morphology is similar to the original drug. Okay, so they shows the psychological responses to the patient, because in some patient what happened here, drug addiction occur. Okay, so for neglection, doctor prescribed the placebo drugs. Okay, so it is the showing the psychological responses. Okay, so it is the placebo. Okay, so one drug is remaining, orphan drugs. So if you talk about the orphan drugs is very rare. Rarely, you can say, it is rarely synthesized. Okay, because these drugs are used for the rare diseases. diseases. Okay, and if you talk about the leprosy is the very rare disease, and for this thalidomide is used. Thalidomide is used. Okay, I will represent here thalidomide. Okay, so this is the drug which is used for the leprosy, but leprosy is very rare disease, and the chances of this disease is very uncommon. So this type of drugs is synthesized in very low amount. Okay, so if you talk about the Huntington's disease, it is also very rare disease. Huntington's disease. Okay, and for the curing of this disease, tetrabenzene is used. Okay, so these type of drugs is synthesized in very less amount because it is used in rare diseases. Okay, the chances of this disease to happen is very uncommon. Okay, so that's why it is called orphan drugs. Okay, so I have completed four term regarding the drugs: prototype drugs, prodrugs, placebo, orphan drugs. Okay, so it is the lecture which we want to cover. Okay, so please, if you like this video, please like and subscribe. Okay, so thank you. Okay.